Hi, I'm Cal Beyer, Vice President for Workforce Risk and Worker Wellbeing. I work for Holmes Murphy in Waukee, Iowa. We're a national insurance broker for property casualty, surety, and employee benefits. I spend a lot of my time in the construction industry, but I cut across other industries and sectors. How can leaders effectively address suicide prevention in the workplace? This is a really important topic. I encourage leaders to do four things. One is build a caring culture. It's really important to have a mentally healthy culture. We do that by demonstrating care, concern, and empathy. When we have a caring culture, it becomes a safety net and people can get help. Number two, recognize these are really trying times. Employee stress, anxiety, and uncertainty, along with grief and increased substance misuse, is causing people a lot of pain in the workplace. So three, incorporate mental health and suicide prevention into safety, health, and wellness programs, as well as HR and employee benefit programs and practices. And the fourth strategy is what we call the 3 V's. Be visible, vocal, and vulnerable. Shared lived experience to let people know it's okay to not be okay. When we model as leaders these behaviors, our employees will follow suit and lean into the care that's being offered. What are resources I share regarding suicide prevention? I'd like people to know the National Suicide Prevention Lifeline is a great service. That number is 800-273-8255. On July 16th of 2022, we'll have a new 3-digit 988 for behavioral health. A second resource is Crisis Text Line. Text HELP or CONNECT to 741-741. A third resource is if you have a full service top tier EAP, share that number with your employees. It can be invaluable, provide guidance in the time of crisis or just a need for emotional support. A fourth resource is the Construction Industry Alliance for Suicide Prevention. A fifth resource is Construction Suicide Prevention Partners as a Take Action Guide. And the last item is a 13-item quick start guide that we've made available for perspectives to share with those watching this video. The 3 V's are behaviors that leaders can model a mentally healthy culture in the workplace. The first V is being visible, letting employees know it's okay to not be okay. And when we're visible, we're talking about it in meetings. We're sharing information. We're promoting our employee assistance program. We have posters about mental health and other resources. Vocal is where that leader is willing to speak about mental health and its importance, how a mentally healthy culture is a more engaged and more productive work environment. And the third is vulnerability. When a leader shares, they're modeling their personal experiences with mental health, and they're letting people know it's okay to not be okay. When those 3 V's are present, it's frequently common that a fourth V will emerge, and that's vertical. Up and down the organization chart, people at various levels will ask to share their story of lived experience, and that becomes compelling. Those are the stories that are memorable, that let people know hope, help, and recovery is possible. That's why we as leaders need to demonstrate those 3 V's.